Hi, and welcome to And So Much More. My name is Cami Smith, and I am here with two very special, very important guests today on our podcast. I have Tiffany Lyttle, and I've written down their titles because they both cover so many different important things. So Tiffany Lyttle is the Patient Education Nurse Wellness Coordinator, as well as Admission Discharge Transfer Team Director, ADT Director. So there's a lot of acronyms and things that float around. We call it alphabet soup.
Oh, yes.
And so I always tell myself it's okay to ask what that means because there are so many. And we also have Wren Roberts, who is the Senior Director of Support Services. And so what are support services? Because that's a very encapsulated title.
It's everything no one wants to do.
Okay.
Okay. No, it is a pretty large scope.
Okay.
Everything from food service, housekeeping, environmental services, security, and the Dawson Inn, which is our Centra hotel.
Yes, that is a lot.
It is a lot.
And it's kind of a lot of different locations too, so you're probably on the go.
All the time.
Often.
Yeah, we've got 99 buildings throughout the Central
Oh, my
campus. And
goodness.
so the majority of my time is within the hospitals and those campuses, but it could be anywhere. It could be in Danville or Amherst or any of those areas.
Okay, very cool.
Yeah.
Well, before we jump into exactly what we're going to be talking about today, I would love to give you guys the opportunity to share just a little bit about yourself. What brought you to Centra so that our listeners can just get acquainted? So, Ren, we can start with you.
Okay. All right. Well, it's been a 31-year journey.
Okay.
So I've been in healthcare leadership roles since 1992. I grew up in Lynchburg. And so after graduating from Virginia Tech, I spent time in healthcare systems in Florida, on the eastern shore of Maryland. I was at VCU Health in Richmond for a while, finished my master's degree there. And then after a wife and 3 children, it looked really attractive to come back home where I so desperately wanted to get away from all those years prior. It looked really great. And the Lord blessed us with coming back to Lynchburg and having an opportunity here at Centra. So I came back as the food service director for the system. And at the time, it was really just the 2 hospitals, and it's grown and evolved. And my role has evolved since then. Added on housekeeping, EVS, and then picked up security about 2 years ago.
Okay.
And so here we are.
Yes.
And it's flown by.
Yeah.
It has absolutely flown by. I cannot believe I've gone from 1992 to 2023. It's
My
crazy.
goodness. Well, and that's encouraging to hear because they often say that, time flies when you're having fun. Time doesn't typically fly when you're not having fun. So that's encouraging.
The days are long, but the years are short.
Yeah, that is true.
In our business, we have
true.
long days, right?
Yeah.
But I'm looking back going, where did the 31 years go? So
Wow.
I'm just blessed to be here, though. And you take each moment as that opportunity.
Yeah. Well, I'm thankful to have you here today.
I'm thankful to be here.
And Tiffany, why don't you tell us a little bit about yourself?
Actually, I'm a transplant. To Lynchburg, Virginia. I came from the border of Mexico.
Okay.
And I grew up in South Texas. And when I came up here, I was not originally a nurse. That's a second career. I was a mental health counselor here at Centra. Went through nursing school, went to Caribbean, and came back in 2017.
Okay. And so when you first came back, I mean, these are many titles under here. So when you first came back, what brought you back?
So I really wanted to be closer to home. My children are here, and it was quite a bit of a drive. And I just, I always loved Centra. They gave me a little bit of opportunity at Caregiver, which is why I went in the first place. But then I found out that there actually was fantastic opportunities here. So I came back in 2017 as a resource nurse, became one of the house supervisors and resource nurse. And then partway through one of our COVID surges, the need became apparent that our healthcare teams really needed that support system too. So that's when I took on the role of the nurse wellness office.
Okay. Which I've heard wonderful things about. We'll have to have you back on here to talk a little bit about some of the nurse wellness initiatives. So today, we are coming under a little bit of more like sobering circumstances because we're talking about workplace violence. And it's something that is happening nationwide. It's something that's escalating nationwide and is, of course, happening right here in our own hospital systems. And I have some statistics here which were shocking to me. And you guys have been doing this work for a while now. And so you are probably very aware of these, but I wanted to read these to our listeners because it really opened my eyes to what our caregivers are experiencing on a daily basis, which blew my mind a little bit. So 1 in 4 nurses are assaulted in our healthcare nationwide system. I'm curious what that statistic may be here at Centra, but we can talk about that. Healthcare and social assistant workers are 5 times more likely to experience workplace violence. 20 to 60% of victims are underreporting, particularly when the victim is a minority or a female. And then verbal abuse and bullying put the nurses, patients, and the system at risk of harm and is a contributor to burnout and the nurse shortage, which really directly correlates with the nurse resiliency work that you're doing. And so these are statistics. I think someone in our office, as we were talking about this yesterday, all they could say is like, that's not okay. Like, you want to that is your immediate response. No one should have to experience this to this level, or really at all. So there's been a lot of work done, and I'm curious how that work began. But first, how would you define, or how do we define for clarification, workplace violence here at Centra?
That's a great starting point, I think. Again, we look at a lot of sources of truth being in a highly regulated industry. OSHA has been managing this for decades, right? And so with the changes we're seeing in society, we're seeing this increased focus on workplace violence, but it's really been there and been part of our continuum for a while. But I think part of what's different is that we're now starting to understand and have more awareness that it's not just about acts of violence, it's threats. It's acts and threats. So when we look at our workplace violence definition, it includes both of those. And it could take many forms. And you mentioned some just earlier, bullying, just threats. They could be an expressed threat, an implied threat, or a conditional threat. And in the past, those probably were not reported.
Yeah.
Maybe we just said, it's just part of our job. They're going through a lot. It's a high stakes, high emotion environment. But we're beyond that now. We can't allow that to just be swept away.
Yes.
Or, here in the South, oh, bless your heart. It's just Wren. It's just Tiffany. Those days are gone.
Yes.
We have to take each one seriously. So it's not just about the acts, it is the threats. And I think that's one of the biggest learning moments and pieces that as we educate and make our staff more aware, getting their mind wrapped around that and taking the education and creating habits here at work that when you experience that, how do you deal with that?
Yes.
What do you do? What are the steps you take? So training our staff that you've got to report that. I don't care how benign you think it was, you got to report it. So let your supervisor know. If you can't find them, let security know. Let our director of emergency management know. Let someone know so we can start the process.
Yes. And so that really speaks to this zero tolerance policy, which was really my next question, because I've heard we now have a zero tolerance policy. And you even talk about that cultural impression here in the South where things are dismissed. It's like, let it roll. It's just who they are. So was there a catalyst for that change, for that shift in perspective?
There has been a change in the legislation because
true.
we are facing a healthcare worker shortage. The workforce shortage is being influenced by workplace violence. And the statistics that you pointed out with women and minorities underreporting is demonstrating that we do have vulnerable populations. We have populations that may not report, and it may be something that they hold to themselves, or it could also be that sometimes it's a disease process and not the person. In which case, as healthcare teams, you never want to report someone with a dementing illness that maybe strikes out at you. Of course they're scared. Of course they're fearful being in the hospital system where there's probably a lot of lights and bells and whistles going off. That is very startling. And so we understand. But we also know that our healthcare teams are leaving with that residue still on them. I have a nurse that has told the story that even though she was attacked by a patient with dementing illness, completely understood the circumstances, we almost come into it with a tacit expectation that these things will happen. Even though she understood it, she was still having nightmares about the incident and had trouble coming back to work and focusing. And that can be dangerous for our patients and for our healthcare teams. So us bringing this to light is also creating a safer area for our community come, because our healthcare teams are safe and able to operate in a safe place. But it also a safer place for our healthcare teams because they can be safe and protected and fully focused in on the patients that they're caring for.
Yeah. And I love hearing just I love I shouldn't say hearing, so don't love hearing it, but I love sharing these personal stories because I think sometimes when you hear workplace violence or when you hear statistics, they're numbers. They're not faces. And stories come with faces and come with very personal experiences, which can make this real to our community and to our caregivers, which is exactly what needs to happen. So it's encouraging to hear that. What type of initiatives have been put in place as a part of the workplace violence initiative process?
Several things. Let's see. Where do we want to start? If we look at the continuum of mitigation, preparedness, response, and recovery, there's a lot of different components in it. And I know Tiffany has a great component around recovery and things like that, and I'm going to let you unpack that. But I think from a mitigation standpoint, and you can chime in and help me too, that's fine, because it is a team effort. I think from a mitigation and preparedness, first off, we recognized we had to have an interdepartmental committee, a steering committee, to where we could say, okay, we got to have a baseline. Let's make sure we understand the entire scope and how comprehensive is this. So I think that's how it started. And from that, we created some subcommittees. So within those subcommittees, we're looking at the physical environment. We're looking at caregiver education and de-escalation. We're looking at data collection and reporting. And then we have a committee about communication, signage, all those pieces. So those levels of subcommittees are doing specific targeted work that roll up to a comprehensive package.
Yeah.
So some examples. So if we take our physical environment subcommittee, so we're thinking about things like badge readers at entrances, video surveillance, not even in the building, but exterior, maybe a parking lot, a call box in the parking lot for caregivers if they're walking a distance to get into the hospital, right? So those are some examples. And I mentioned earlier, we've got 99 buildings. So how do you get your arms around that level of investment and commitment? It takes a team, right? And that's not a 6-month process, right? This takes several years to build and grow. And so we've been doing work in those areas, good methodical work for really the last 24 months and still have a ways to go. But we're doing a lot with that. So badge access, video surveillance, panic buttons, those are some physical environmental examples. So when we look at that level of a subcommittee, there's a couple of components. So with education, it's a critical part. So with education, that helps promote the awareness, right? So we partner with our corporate director of emergency management, Joe Tolga, and his fabulous team to help do education around active threat, right? And putting together level of detail up to and including things like, Wren, where in your office, where you work every day, what's going to be your safe space?
Oh, that is so
Right. So we
important.
want that level of detail as we educate and make someone aware, because what we don't want to happen is you hear that announcement and it's a deer in the headlights moment.
Yeah,
And
and because you've
we've
run.
seen that. And in the industry, that's a lot of times what we hear about. So we're committed to doing a deep, deep dive to where that level of education awareness can't be done by just the corporate director of emergency management or Cami or Wren or Tiffany. So as we educate our leadership, we're expecting them to take that and incorporate that into their monthly huddles, their weekly huddles, talk at that level. So another component is CPI, Crisis Prevention Institute. We're partnering with them on training and educating our high-risk caregivers. And we've categorized all of our caregivers into those different categories. So with our high risk, we're primarily focusing on our ED staff, emergency department staff, our behavioral health staff, our security staff, nursing supervision, those where we've seen the data that shows the highest propensity for a threat or an act. All right. And so with that, they go through online module training, which it doesn't stop there. This is not one of those things, Cami, where you can watch a video and say, check the box, we're done, we're good, we're safe, we're good. They then have to take that knowledge and go through classroom training up to and including knowing how to deal with nonverbal intervention.
That is incredible because I've watched the videos. Like I've taken the surveys, I've watched the videos where you answer the multiple choice questions afterwards. And it is helpful because the questions kind of help you step into a perspective switch. But gosh, to be doing that level of like interaction as well, that's really cool.
And it's a big lift. I
Yeah, oh,
mentioned
I'm
earlier,
sure.
one person can't do this. So we have trained and had certified Centra caregivers to become CPI instructors.
Okay.
As a matter of fact, we have 10 additional ones that are going through training August 8th, 9th, and 10th right here on
That's so
campus.
encouraging.
So it demonstrates that continued investment
Mhm.
from our senior team that they take this seriously. They
Yeah,
support the work because, again, talk is cheap.
it is.
It is. And so we've got to be able to demonstrate how we are evolving as an organization. And
Yes,
it's exciting to watch us grow and learn through that.
that is
It's,
incredible.
and it's not easy. Like I said earlier, take a little bit each day, one step, one foot in front of the other to
Mhm.
do that. And so I mentioned earlier that high risk bucket of caregivers. We still have a moderate risk, a low
Mhm.
risk. There's components that will be rolling out in the future for
Okay.
them as well.
Okay.
So those are just some examples of some of the tangible things that we're helping
Yes.
steer and talk about at that workplace violence committee level.
Yes. Well, and it's so important to hear what is being done, even on like that granular level, because you hear these statistics and they are so shocking. And immediately your thought is, what is being done? Like, what can be done? And it's not an easy, XYZ. It's
It's
not
not an
a
easy
quick
answer
It
every time,
fix.
right?
isn't.
I mean, it's just
Yes.
not.
There's so much. And I think it helps to build people's understanding of the level, like how many facilities we have, how many caregivers we have. It's just an enormous responsibility and an enormous cultural change as well that involves the community as well as caregivers.
Right. If you think about all of those campuses that we have, not every campus has on-site security. So think about our CMG sites, and they do great work. So we have to build and craft plans that still work with the
Yeah.
resources we have. There is a paradigm, I call it a legacy paradigm, where there's an expectation that I need to have a security guard in line of sight at all time. It's not reality.
Yeah, it's not.
It's not. And so that's why we have to be able to unpack all this and make sure we build a robust education process that we can then evaluate continuously to make sure it's effective.
Yeah.
And having
Yeah,
that plan is so empowering too, because,
that's very true.
there are steps I can take to get to a place of safety, to take care of myself
Yeah,
and my community and my patients.
right. Agreed.
So you mentioned a recovery, and so Tiffany, I would love for you to elaborate a little bit more. So I'm assuming, I hope I'm not speaking ignorantly, but I'm assuming that's for those who have reported or those who are suspected of maybe experiencing and not reported, because that's such a huge number we're seeing.
It is. And the reason that that span is so big, 20 to 60% are expected to have underreported. It's because we really don't know. We don't know who's staying silent. And, like I said, healthcare workers come into the workforce with that kind of tacit expectation that something will happen, that we will be hurt. And the thing is that most other careers, people don't go into it with that expectation. Like, if I decided to have become say, a real estate agent or an attorney or someone who ran a bakery, I would not go in with the expectation that I would somehow be abused, bullied, or threatened. Healthcare workers are a little different breed. We come in here knowing that we're dealing with people in pain and fearful, and
Yeah.
sometimes with neurodivergence that will create situations where they become fearful and strike out.
Mhm.
So, in the event that something does occur, and I have so much faith in what Ren and Joe are doing, I just really do feel so much safer in knowing that they have taken over these reins and are just doing phenomenal things within our organization. My year working with Nurse Wellness, what we have discovered is that it's very difficult to find a place of higher health. And to say, probably Maslow's hierarchy of needs is really kind of the visual picture I have in my head,
Okay.
where we start in one place, and as we are able to address our needs for food, safety, or shelter, water, hydration, our biological needs are met, we move up to that next level. So when I do rounds, a lot of the times our healthcare teams talk to me and they tell me, I'm fearful, or this happened, or I was punched today because I could not give an order for something because that's outside of my scope. I can't give those orders. And I realized that we really needed something for taking care of our teams if they experience that violence, because we can't expect them to get to that level of self-actualization if they're still living in fear.
Yeah.
Well
So
said.
remove the fear and bring back that health and wellness and that approachable health and wellness.
Okay.
I looked out there for any models for this,
Mhm.
and there really aren't any. What I did find was through the FBI, they had a mass casualty situation with a recovery method for that. And that really wasn't fit for what we were doing. So we here at Centra just kind of came up with one. It is a toolkit response for any healthcare team and leadership because the leadership is also integral in being able to walk our teams through those steps of
Yes.
not only reporting, speaking up, because as we speak up and we normalize the reporting process, we create a band of safety. We identify those potential barriers for the next person that might walk in the room. So I might know that so and so gets very agitated with this certain noise, or if I do this, but the next person to walk in after me may not.
Mhm.
And we need to be just as protective of our whole team and not just, the next person we're handing off report to. So we identify those barriers and normalize the reporting experience because we all deserve to be healthy and safe. The second part of that is leading them through the process of identifying what's happened. Sometimes we just need that space. We need to call our loved one and kind of go through our mental cues like, am I okay? Am I hurting anywhere? Am I feeling okay?
Yes.
How do I really feel about what just happened? Can I shake it off? Do I need a minute? So giving them that space. And then, of course, those additional resources. And we all have it through QR code. It can be printed on any facility at any time. QR codes for resources for now or resources for later, and resources within Centra, resources at a state level, and also additional information from our chaplaincy because they are well loved and trusted. And Darren's team just does a phenomenal job
They
of
do.
taking care of our teams.
Yes.
And our health works, of course, because they're phenomenal too. And Dee Rainey has done amazing work with our teams. And then even further on beyond that, like our national hotlines for crisis intervention or suicide hotlines, having those sorts of resources as well, just in the event that we need help. But we've also included in this packet because we did realize that a lot of times it is disease process and not person. We wanted to make sure that there were different areas to glean information from. So the National Institutes for Health, or NIH, provides a lot of great information about how to take care of someone with maybe a dementing illness or neurodivergence and how to keep the stimulation levels at a minimum. So we do have that included in the packet too, just in case.
That's incredible. I think that you think about the people who fall through the cracks, and they are so often the unseen pain that can have an outburst or a situation that puts other people at harm intentionally or unintentionally. And so I think seeing how Centra is going out of their way to take care of both sides of the situation is so encouraging because there are two sides to the situation. Doesn't make either okay, but that's the reality of workplace violence is that you don't expect it and you probably hope that it won't happen, but to know that there are people ready and waiting with proven techniques to help you. Have you had any instances where even recently where this has been put into place, and how has that gone? Because we've gone from things like that not being available, and we've talked about resiliency and retention. And so having these in place, have you seen an impact?
We have, and I won't identify the groups that have called for them, but we have actually started integrating them into our Code Lavender response cards,
Okay.
which is probably a whole other podcast. But it
Yes.
is the response cards for our teams when they're in distress so that they have, like I was talking about Maslow's hierarchy, we make sure that they have snacks, they have hydration, they have resources for now and later. Sometimes we just need some space and to be able to take
Mhm.
that 8 minutes away. But we wanted to make sure that those were integrated onto the carts and they have been utilized. In fact, we've had team members that have reached out to the local resources afterwards too, to make sure that,
Wow.
they had follow through and that someone had called them and made sure that they were okay. And that's an
Yeah.
important part of being, not just healthcare givers, but also receivers and making sure that we're healthy enough to take care of the people
Mhm.
in our community.
The cart, I think, is especially important because you are more able to assess your own needs and even what you may have just experienced if you're in a better mental place. And so to get them into a better mental place so that should something happen that could jolt them, they can take appropriate actions, which is kind of what I wanted to talk about specifically for those who are listening. How do you report if this has happened to you? So, I mean, with all the work that has been done, this may be really well known, but in case there are those who are not sure, you've had an experience where there's been some level of violence, some level of assault, whether bullying or more extreme, what do you do? Where do you go?
So let me start off by saying when you verbalize, you mobilize, right? And so you have to speak up. So we want them to go to that immediate supervisor. I could be on the 7P to 7A shift, so it may be a charge nurse, right? That's where we start. Again, find someone to report it, right? So there are some immediate things that way. So verbalize means to mobilize, so that gets it started. We have a wonderful platform that the organization has in place called RL6. And so we document, and that's part of our data collection, which is one of our subcommittees, right? So that's how we get the robust data. So everything that's reported would be funneled into RL6, and that's sort of the repository for next steps.
No, that's fantastic. The only other part of the response toolkit is that we do have that leadership infographic that helps our leaders be able to walk their team members through it. Just because being a brand new leader sometimes can be intimidating. So to know, like, lead your team member to the RL6, make sure they've had an opportunity to take care of their physical wounds or emotional ones, let them talk to their person.
Yeah, that is very good to know. And for those listening, to verbalize, to speak it out loud, acknowledge that something that is not okay is not okay. Is there any other aspect that you think would be important for our listeners to know?
I would say, I'll jump into the pool on that one. 8,000 caregivers here at Centra, we are part of this community.
Yes, we are the
So,
community,
so
right? Yeah.
we are, and so we want this community to be the safest community possible.
Absolutely.
And so all of this work has a purpose, and we take it very seriously. And we're not perfect. We're going to continue to pursue safety and excellence.
Yes.
And I'm excited about the journey that we're on and the progress we've already made.
That's right.
I did want to share, because I think that this is really incredible. So the legislation that you briefly mentioned earlier that was passed just at the beginning of this month on July 1. So back in 2019, the Virginia Assembly, it strengthened the protections for healthcare workers by making it a Class 1 misdemeanor to threaten, kill, or harm any healthcare workers while they are rendering care in a hospital, emergency department, or clinical facility. And then just recently, at the beginning of July, they extended that protection to providers rendering care in all healthcare settings. And so I think that's really pivotal for our healthcare workers. And also one of the reasons that we want to kind of help push this into the spotlight, the initiatives, the care, but also the fact that, we see them, like we see you, we see that this is a thing and we're doing something about it. I would love to also encourage those of you who are listening. We have shared some of these statistics as well as the legislation, and even some of the things that Centra is doing to care for our caregivers as well as our community on our social channels, on our newsletter, Centra Today. We actually have a nurse sharing her personal story, and I encourage you to go check that out on our website. There's so much to this. Like, this is just such a scratch on the surface. But I love that we get to talk about it even a little bit. So thank you guys so much for coming in. And thank you all for listening today on And So Much More.